This case presents a cow suffering from upward patellar fixation, a condition where the patella becomes locked over the medial trochlear ridge of the femur. As a result, the hind limb remains extended, and the animal is unable to walk normally. The cow drags the affected limb and struggles to flex the joint, especially after standing from rest. This condition may occur due to hereditary factors, weakness of the quadriceps muscle, nutritional imbalance, poor body condition, or prolonged confinement with limited exercise. Diagnosis is primarily clinical. The affected limb remains extended and locked during movement. Sometimes manual manipulation can temporarily release the patella, confirming upward patellar fixation. After confirming the diagnosis, surgical correction was planned through medial patellar desmotomy. The procedure was performed in standing position using proper physical restraint to ensure safety and control. The medial aspect of the stifle joint was shaved and thoroughly disinfected to maintain aseptic conditions. Local anesthesia was administered at the surgical site to minimize pain and discomfort. The medial patellar ligament was carefully identified by palpation between the patella and tibial tuberosity. Accurate identification is essential to avoid damage to surrounding structures. A small stab incision was made directly over the medial patellar ligament. Using a sterile scalpel blade, the ligament was carefully isolated and transected. This surgical release eliminates the locking mechanism responsible for the condition. Immediately after transection, the limb was flexed and extended manually to confirm successful release of the patella. The cow was then encouraged to move. Normal flexion of the stifle joint was restored, and the animal walked without stiffness or dragging. Postoperative management included antibiotics for 5 days, anti-inflammatory medication for pain control, and restricted movement for a short period. Medial patellar desmotomy is a simple, effective, and permanent solution for chronic upward patellar fixation when performed with proper technique and care. Subscribe to Vet Nova Care for real-life veterinary surgeries and professional clinical guidance. Click the next video on your screen and continue learning with us today.